Good afternoon and welcome to our daily briefing. The crisis has affected all aspects of our lives, from public health employees to employment, and one of the impacts that it has had has certainly been on our business community, especially our small businesses. From mom and pop stores to cafes to restaurants, small businesses have suffered tremendous losses and impacts. And that's troublesome because our small businesses are truly the backbone of our local economy. So today we'll be highlighting the resources that are available to our local businesses, and to help with us deal with that issue is Jamie Pritchard Solorzano, who is the Economic Development Specialist and Administrative Officer for the Small Business Administration San Diego District Office. We'll get started with the comments from Supervisor Fletcher with an update on our numbers, and then we'll hear from Jamie from the Small Business Administration, and then we'll get the medical update from Dr. Wilma Wooten, our Public Health Officer. So let's go ahead and get started with Supervisor Fletcher.
Thank you, and good afternoon. Today, Governor Gavin Newsom announced that California is working in partnerships with the state of Oregon and Washington on the process of reopening our economies and rebuilding the West Coast. He outlined that these efforts must be based on a number of things. One, understanding the total health impacts of COVID-19, including the direct impact of coronavirus, the health impact of the measures introduced to control the spread of coronavirus, our health system's ability to ensure care for those who might need treatment from COVID and other conditions, and efforts protecting vulnerable populations at risk if infected, specific things around efforts around senior centers or long-term care facilities and nursing homes, protecting the general public by ensuring any lifting of interventions includes the development of a system of testing, tracking, and isolating positive cases. He outlined that this process will be guided by data and metrics, along with input from public health experts. While we are still all in the phase of fighting the immediate community transmission of COVID-19, and our efforts and focus must continue in the present, we appreciate the efforts by the state of California and believe their approach and their framework is wise and prudent. Just as states will work together, the cities and counties in California will work closely with our governor and the state of California to ensure that all efforts are aligned both regionally and statewide. I spoke with the governor after his press conference and before today and conveyed that our entire Board of Supervisors and our public health doctors look forward to collaborating and providing input in representing the interests of San Diego County to the state of California on any efforts surrounding recovery, rebuilding, and reopening. But to reiterate and to really reinforce this point, that while there are state and national and local conversations taking place around reopening, these conversations will be severely negatively impacted in the ability to move forward with or implement if our current positive trends and encouraging news are reversed. We have had success as a region in flattening the curve. We have had success as a region in slowing the transmission of coronavirus. But if that success changes because our posture and our actions in the coming weeks change, then we will significantly set back any efforts and any desires on the part of folks to begin the process of rebuilding. And so we want to reiterate that it is vitally important that while we see those conversations taking place and we see those efforts underway, it is very, very important to know that the ability to implement those is directly tied to our ability to stay the course and continue to see progress in the coming weeks in San Diego County. In addition to discussions around efforts to possibly reopen and recover, the simple reality is the actions that have already been taken have had a very severe and negative impact on our economy, both on workers, on small businesses, on all businesses. And as this process began to unfold in February and particularly into March, we asked San Diegans to take unprecedented, often uncomfortable steps that were needed to protect life, to protect all of us here. The non-pharmacological measures of physical distancing, of restricting to essential services and essential businesses have proven to thus far be effective. We know that it has saved lives, and we know that it has protected the public health of San Diego, but we also know that this has had a very devastating impact to a lot of folks. Hard decisions have had to be made. Many folks have had to re-engineer or reimagine how their businesses stayed open. Many have had to lay off and furlough workers. Many have had to close their doors and stare down a very difficult prospect of coming back. And we want everyone in San Diego County to know that while the efforts have been efficient and appropriate in what we know that we needed to do in order to protect us from a horrific pandemic, that we do appreciate the sacrifice that has been made, and we do know that there's going to have to continue to be a lot of help and assistance provided to get things back open when the time comes, but also to mitigate the damages that have already happened. Small businesses have borne a significant brunt of the burden and the slowdown in the economy, and we know that there are a number of programs and efforts, which is why today we have a representative of the Small Business Administration here to talk specifically about what is available to you now to help ease you through this difficult time and to help provide some assistance and relief to bridge over until such time as we can begin to reopen and reimagine and begin to move forward into a different posture. And we appreciate the SBA. We'll also be sharing a few state resources that are there. And so we ask you to hang in there. No one is unaware of how difficult it is and what the impacts have been. And know that we will get through this and we will rebuild, but it is vitally important that we do it in the right way. We do it in a thoughtful way, we do it in a data-driven way, and we do it in a way guided by public health. Before we get to that, I want to address the issue of homeless. We've been asked several times about the number of positive tests for the homeless, and while we previously have not reported these as separate from the overall numbers, we do believe it is appropriate to share them on an ongoing basis, given the challenges coronavirus presents to this population and the wide variety of efforts that are in place to try and help these individuals. We will work these numbers into our current reporting in the coming days, but I want to give you the latest total. Presently, we have identified 13 positive cases who are homeless out of a total of 1,847 total positive cases. So again, out of all of the positive cases, 13 of those are from the homeless population. 9 of those 13 were from the unsheltered populations. These were identified through our healthcare partners and the homeless outreach teams, where we have embedded public health workers. 4 of the positive cases came from existing shelters that were identified by public health nurses or by our shelter partners who were operating those shelters. To date, no positive cases have come from the convention center. Out of the 13 positive cases that we have had, 11 of the 13 received temporary lodging in our public health motels. This was designed to protect the public and ensure proper isolation. 2 of the 13 positive cases are presently hospitalized, and they will have public health motel rooms available to them when they are released from the hospital, again, in an effort to protect the public and ensure proper isolation. In order to clear or leave a public health motel room, an individual who is tested positive has to either be retested with a negative result, or they have to have had 7 days, past 7 days since the onset of symptoms, and no fever for 3 days without other medicine or intervention, and that is per CDC guideline. A part of the MOU on the Convention Center with the City of San Diego allows their unsheltered individuals to be transferred to the Convention Center upon release from the public health motel rooms. And while we do not disclose individual locations of positive cases, any shelter that has had a positive test is aware of this and works closely with our public health teams to make sure that all appropriate steps are taken to ensure that site, along with everyone else who is located in that site. Now we will move to our daily charts and updates. We will start with our total number of new cases and total cases. You can see today we are reporting 43 new cases, bringing us to a total of 1,847. Testing, we're reporting 898 tests performed in the last 24 hours, which takes us to 26,132 tests that we are aware of cumulative to date in San Diego County. Next, you'll see the spread between test and positive. The percentages there remain generally consistent. And our final chart here on charts has our positives, those estimated recoveries, and again, those are a statistical sampling based on the 14-day recovery period estimated, our cumulative hospitalization, along with the ICU numbers, which are a subset of the hospitalized numbers, and then the unfortunate loss of life, 47 San Diegans to date. Outreach efforts continue. Increase in 211 calls. 211 has been a great resource and ally to us in this difficult time. Increase in nursing calls, epi calls, hygiene kits, hand washing stations, and toilets distributed remain flat and static, although those efforts to service them are ongoing. An uptick in every category of PPE minus goggles, which stayed flat. We are now pushing 2 million individual items of personal protective equipment that have been distributed. Very little change in the public health motel rooms and the regional task force on homeless rooms. A little downward trend in the number of rooms occupied, a little upward trend in the number of guests, but both of those efforts continue. And we have all 23 hospital systems reporting today on the number of ventilators available, 566. Along with 93 that are in county stockpile that are ready to be deployed at any time. Before I introduce Jamie from the SBA to talk about some of the programs that they offer, I want to mention a few state programs that are available in addition to what the SBA is offering. If you go to the state's website at covid19.ca.gov, covid19.ca.gov, under the Business and Employers section, you will see the California Infrastructure and Economic Development Bank, iBank Finance Program. The state of California is allocating $50 million to the small business finance centers at California's iBank to mitigate barriers to capital for those small businesses, 1 to 750 employees that may not qualify for federal funds, including businesses in low wealth and immigrant communities. So that program is available. There's a relief and extension for filing tax returns for businesses. The governor issued an order to offer small businesses interest-free deferral of sales and use tax up to $50,000 for businesses with less than $5 million in taxable sales. And the California Capital Access Program, CalCap, that's for 1 to 500 employees. It's a loan reserve program which may provide up to 100% coverage on losses as a result of certain loan defaults. Individual borrowers are limited to a maximum of $2.5 million enrolled over a 3-year period. To learn about these resources, we encourage you to visit the State of California website. Additionally, the county hosts weekly telephone briefings on Wednesdays at 9:30 for our small business and business community sectors. To sign up to be a part of these, to hear from experts and ask questions, visit coronavirus-sd.com. Go to the Community Support Sector page and look for Business and Employer tab, and you can sign up to be made available of those resources. I'd now like to turn it over to Jamie with the Economic Development Specialist with the Small Business Administration San Diego District Office to provide you an update on SBA programs that are available to help small businesses. Thank you.
The United States Small Business Administration is here to help. We are delivering service to San Diego small business community now. As a result of the CARES Act, the SBA has programs in place to support all types of small businesses. Today we are going to cover four programs. One, the Economic Injury Disaster Loan and Disaster Loan Advance. 2, the Paycheck Protection Program. 3, the SBA Express Loan Program. And 4, the SBA Debt Relief Program. The Economic Injury Disaster Loan Program and Advance are available to provide relief to small businesses to overcome the temporary loss of income due to the coronavirus. How do I apply? In order to apply for the SBA disaster loan, you can take action now and you can log on to www.sba.gov and apply online. The second program, the Paycheck Protection Program. The Paycheck Protection Program is an SBA loan that helps businesses keep their workforce employed during the coronavirus crisis. It includes small businesses, nonprofits, 501c19, veteran, and some tribal businesses with less than 500 employees. This includes sole proprietors, independent contractors, and those that are self-employed. This loan, in addition to the Economic Injury Disaster Loan, offers a forgiveness feature, provided a percentage of funds are used on payroll to keep people working. How do I access Paycheck Protection Program? To access the Paycheck Protection Program, you would contact your local SBA lender, participating financial institutions. The third program that we're going to discuss quickly is the SBA Express Bridge Loan Program. SBA Express Bridge Loan Program. If you currently are a small business owner and have a relationship with an SBA Express lender, you can apply to access up to $25,000. This is a loan, and you would go to your nearest SBA lender that you already have a relationship with. The fourth program is SBA Debt Relief. What is SBA debt relief? SBA debt relief is a financial reprieve for small businesses during the coronavirus outbreak. What does this mean? If you have an SBA loan, special processing and loan deferments are in place to support your small business. With these loans, if you want to learn more on how you can get help with loan deferment, you can learn more on sba.gov, or you can contact your local lender. So to recap, economic injury disaster loan available right now online. Paycheck Protection Program, you would secure an application and take that to your local lender, financial institution. SBA Express Bridge Loan offered through local SBA lenders. And the loan and the SBA debt relief deferments and special processing if you already have an existing SBA loan. So those are the four programs. How are we delivering our mission? We're delivering our mission every way possible. Online at www.sba.gov. On the phone, we are servicing our callers into our office. We've spoken with thousands of people over the last 3 weeks that need help with their small business. And we also are working with our resource partners located throughout San Diego and Imperial County. We have a robust resource partner network. They offer free business counseling with many locations throughout San Diego, over 10 different offices. And I'm going to include 4 of them right now: the Small Business Development Centers, SCORE, Service Corps of Retired Executives, the Women's Business Center, and our Veterans Business Outreach Center. These are offices that can help you to complete applications or walk you through the program if you have more questions. The SBA is here for small businesses today and in the future to help your small business grow, expand, and recover from disaster. To learn more, I urge you to take action now. Visit our website at sba.gov. Visit our San Diego District Office website at sba.gov/CA/San Diego. Thank you. We appreciate your time, and we look forward to servicing the small business community.
Thank you, Jamie, and welcome and good afternoon to everyone. I would like to thank San Diego residents for doing your part to stay at home, and when you leave your residence for essential reasons, we want you to please cover your face in public. Regarding global, national, and state statistics based on data from Johns Hopkins dashboard that was obtained at 11:30 a.m., globally, there have been 1,897,373 positive cases, which includes just over 118,000 deaths. Nationwide, there were 568,176 positive cases reported, which included almost 23,000 deaths. Statewide, there have been 23,501 positive cases, which includes 683 deaths. And today, the County of San Diego is reporting 1,847 cases, which is 43 cases more than yesterday, and 47 deaths, which is 2 more than reported yesterday. The 2 additional deaths include a female in her late 90s and a female who was 100 years of age. Of the 1,847 cases, the age range of all of our cases is from 3 months of age to 100 years of age. 958, or approximately 52%, are between the ages of 20 to 49 years. This percentage continues to remain constant. 905, or 49% of our cases, are female. 937, or just over 50%, are male. And 5, or approximately 0.3%, had no gender identification. 420, or 23% of the cases, have been hospitalized, and this includes 156, or approximately 8.4% of the total number of cases admitted to the ICU. The number is also 37% of the total number of those individuals hospitalized. Lastly, the 47 deaths represent 2.5% of the total number of cases. All except 2 cases had underlying medical conditions. And we continue to emphasize this point because COVID-19 significantly impacts our older adults and individuals with underlying medical conditions such as heart disease, chronic lung disease, asthma, and diabetes, as well as compromised immune system. Our vulnerable populations matter, and we want to keep them safe, so please adhere to the strong recommendations and the health officer's order that protect these populations. Also, of the 47 deaths, 45% were female, and 55% were male. Regarding the race and ethnicity of this group, of the 47 deaths, we have data for 37, which is 79% of the total number of deaths. Of this total, 22, or 59.5%, are white, 12, or 32.4%, are Hispanic or Latina, 2, or 5.4%, are Asian, 1, or 2.7%, is of multiple races, and none of the deaths have yet to be identified as Black or African Americans, Pacific Islanders, or American Indians. Our sincere sympathies once again and condolences from the County of San Diego go out to the families and the friends of the individual deaths that we have announced today. As a reminder, all of our demographics are found on our county website at www.coronavirus-sandiego.com. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 31 confirmed outbreaks, which are unchanged from yesterday. These include 20 outbreaks in congregate facilities representing 182 cases and 22 deaths, 11 outbreaks in community setting locations representing 43 cases and 1 death. Regarding testing, as of April 12th, county, hospital, and commercial laboratories have conducted 26,132 tests, which includes the current total of the positive cases reported today, which represents 7% of the total number of those individuals tested. Lastly, today I am very excited to announce the Organization Award recipient of the 2020 Live Well San Diego 19th Annual Public Health Champion Award. This year's organization recipient is MotherToBaby California. This is the nation's leading authority and most trusted source of evidence-based information on the safety of medications and other resources during pregnancy and while breastfeeding. This service was established in 1979 at the University of California, San Diego, with the name San Diego County Teratogen Registry. This information service is available to mothers, healthcare professionals, and the general public. For these reasons, I am pleased to announce that MotherToBaby California is our organization recipient for our 2020 Live Well San Diego Public Health Champion Award. In closing, I cannot thank the public enough for staying the course to stay at home, to decrease the spread of COVID-19. So everyone is making tremendous sacrifice, and I am confident that our collective efforts are working. Now please welcome back to the podium Chairman Cox.
Okay, we're going to get right to the questions. Again, if we don't identify you by name and outlet in the introduction, please do so. Let's go to the first call.
KUSI, please state your name and question.
Hi, this is Hunter Sowards, and I just had a question. It was more of a follow-up to something that was announced, I believe, on Saturday. Supervisor Fletcher had said that they would be announcing a COVID-19 testing coordinator. I'm wondering if that's a person or team of people who are going to be kind of announced, I guess, for that. And then also a follow-up on when those tests are going to be made available to the general public.
Okay, let me ask Supervisor Fletcher to respond to that.
Yeah, our folks have been working and are close to having that in place. And again, this was just to augment the great work that has been done around testing by all of our public health folks. They've been doing a really great job. But as there is new tests coming online, as there are new things being introduced to augment and give them a little bit of help is all being put together through our public health labs. And when we have more specifics to share on that, we will. But it's recognizing not only the challenges in today's world of a lot of new testing coming online, but two, the second part is one thing the governor outlined today is that any part of being able to consider reopening is going to be the availability of rapid testing and the ability to test, trace, and isolate. So it really is with those two aims. And so we'll continue to keep you posted on the progress on that, but it was just a recognition that we need to continue to do more in that area.
This is Dr. Wooten. I just wanted to add to that. We recognize that there are a lot of entities or vendors that are coming to the forefront with offering various tests. So we have identified individuals that will work on that piece, as well as identifying, working on the piece of making sure that we are capturing all of those entities. And if they do start testing in our jurisdiction, that we have the tests, both negative and positive tests. So as these other entities are identified, we will be onboarding them, if you will.
Thank you.
Okay, let's go to the next question.
NBC 7, please state your name and question.
Hi, this is Claudia Stefanian with NBC 7. You know, coming out of the weekend, I know we usually see some sort of lag when it comes to numbers, and today not seeing terribly too much of a jump. Should we take something out of this? I know that when we're talking numbers, usually, it should be 10 times that, but it seems like the numbers might potentially be dipping off. Should we be taking that from the numbers that are being given from the county?
Dr. McDonald is going to respond to that.
Yeah, I think it's worth repeating something that's been said over and over and again here, which is that any one day's test results really don't indicate a trend. In fact, even several days don't indicate a trend. And so there are variations in what we report. Sometimes it's because of batched information that comes into us. It has a lot to do with who is tested when. I think often after a weekend the numbers are slightly lower, and then you'll see the numbers get reported more. So again, it's extremely difficult to interpret these results day by day. In fact, what I would do is step back and look over something over a 1 or 2 week period in order to really understand trends. We do that with flu. And I think that with a disease like this, where there is indeed a longer incubation period and a longer time between the onset of symptoms and how ill someone can be and be hospitalized and unfortunately sometimes die from this disease, the time frame is a lot longer. And even though we report every day, and I understand your desire to really interpret on a day-to-day basis, I really would step back and look at it as a longer-term trend.
Okay, let's go to the next question.
CBS 8, please state your name and question.
Hi, David Gottfredson from CBS 8. My question is regarding a couple of new antibody testing sites that have opened in Southern California, specifically one in Cardiff. I saw that the FDA basically okayed the creation of these antibody tests without regulation, and I'm wondering what your opinion is in terms of people going to these pop-up drive-through testing sites.
Dr. McDonald's going to answer that question.
Yeah, thank you. That's actually a really important question because I heard that same report on the news this morning as I was coming in. It's frankly the first we'd heard about that specific drive-through location, which is, I have to say, different than what we've experienced before here in San Diego, where our public health lab and our public health professionals have worked closely with our local systems to develop testing, to make sure that they're valid, and to make sure that they're rolled out and are in fact interpretable by our local clinicians and our patients themselves. And so antibody tests are challenging. They are not as perhaps as precise a tool to make a diagnosis as the PCR tests, which we've been using up until now. And although the FDA has certainly encouraged the development of these tests, they have a very specific role, and their role really isn't necessarily well settled at this point. So we are working with our local health systems, with the state, and with the FDA to try to understand how these tests fit in to the overall interpretation of this disease. And specifically with the drive-through that is in Oceanside, I believe it's, I'm sorry? It's in Cardiff, yes. I'm sorry, the precise location I couldn't remember off the top of my head. But I can tell you that this particular organization has set up testing in other locations in other counties. And so when we ask them for documentation of the test that they were using, they actually are doing two tests. One is the PCR test, which you don't get immediate results on. They send that to a lab, I believe, in Texas, and they get some results in a couple days. That test looks like it is based on the technology that has been confirmed by the CDC and is in fact a emergency use authorization test. However, this serology test, or the blood test that's being used, isn't. And in fact, when we asked for some documentation, they were kind enough to present it to us, and I'm just going to read right what it says from the document that they provided. And it's in bold print. It says, "The test has not been reviewed by the FDA, and results from antibody testing should not be used as the sole basis to diagnose or exclude SARS-CoV-2 infection or to inform infection status." So that tells me that a positive test might not mean it's positive, a negative test might not mean it's negative, and this is actually very true of a lot of these serologic tests. If you think back a couple years, we had the Zika come into the Americas, and we had a lot of local Zika cases that needed to be evaluated. Most of those tests were identified by PCR and were reliable, but some of those individuals who had Zika actually were tested using serology. It often took weeks and weeks to figure out whether that test meant anything, whether it really meant Zika infection or actually infection from something else. And that's something we don't know about these serology tests, whether it means specifically you were infected with this coronavirus or maybe another coronavirus. Also, the timing of the test is important because it's known that it takes time to develop antibodies. So if you take the test too early, it could be a false negative even if you have the disease. So again, very difficult to interpret. And frankly, I wouldn't really want to interpret it without a physician's involvement in the setting of a drive-through. Now, I'm not saying that drive-throughs aren't important and aren't going to be very critical for us to evaluate patients into the future. But the exact role of this test really needs to be taken with a little grain of salt.
Dr. McDonald, just a quick follow-up. Did they tell you what lab they were using for the antibody test and where it's located?
Well, the antibody test they're using as a point-of-care test at the site. So again, there is only one point-of-care test that I'm aware of that's an antibody test that's been authorized by the FDA, and that's not the one they're using. So the test that they're using for the PCR is not in the state.
Right, but they didn't tell you which lab developed the point-of-care test?
They did provide that documentation. It is a test that I believe was developed in China, and again, I don't have the name of the specific laboratory in front of me that developed the test. I do have who marketed the test, and we can provide that to you offline.
Thank you.
Okay, let's go to the next question.
Voice of San Diego, please state your name and question.
Yes, hi. This is Will Huntsberry, Voice of San Diego. So things have looked better recently here in San Diego, as Supervisor Fletcher said. And we hope we never get to the point where we're running short on resources, but obviously that's something you guys have to be planning for. You know, if we had more ventilators, more patients who needed a ventilator than actual ventilators. And so the county's been working with hospitals to create a triage plan that would help physicians objectively make that decision about who the ventilator would be prioritized for. Can you talk about what's in that plan, so hopefully from a medical official on that, and can you talk about why you haven't gotten public input for that plan yet, and will you get public input on that plan? Seems like something the community would want to weigh in on.
Okay, Dr. Wooten will answer that question.
Thank you for that question, Will. There are a number of plans out there, and I think you're talking about crisis care. The state actually is coming out, hopefully in the near future, with that, because we would want to be in coordinates and in alignment with what's going on across the entire state, not just here in San Diego. So as you are aware, when you are planning, you want to look at, number one, what is the evidence? What does it state? Are there other plans that are out there? And we certainly have been in the process of doing that, but again, we are waiting and want to know what the state is going to do, and then we will align with that guidance.
What if the state doesn't come out with a plan and we get in a situation where, you know, we need to make difficult decisions about ventilators? Will you release a plan then, and will you try to get public input?
Well, well, if we have a plan, we will obtain public input, but I'm confident that the state will be releasing something in the near future, and we will align with that.
Okay, let's move on to the next question.
Union Tribune, please state your name and question.
Hey, this is Paul Cincinnati UT. So far to date, only patients who have very severe symptoms, pretty much those severe enough to be hospitalized, or those in various at-risk groups, have qualified for testing. That's because the testing has been in short supply. But in the last week or two, we have definitely heard a lot of reports of more testing capacity coming online, especially at our local hospitals. I wonder if the county is close to recommending that all patients with any possible COVID symptoms be tested. Or are we getting to the point where we can have widespread testing finally?
Okay, Dr. McDonald's going to answer that question.
Yeah, thanks for that question. It is a really good and a key question that we need to evaluate day by day. I don't think that we're there at the point where anyone who has symptoms should be getting tested. I think there still is a need to kind of prioritize tests to certain groups. I think those groups are expanding, and each hospital and healthcare partner that we work with are working with their populations to do that very work, whether it means more testing in skilled nursing facilities and in congregate living facilities, whether it means more frontline workers, and you can use a wider and wider definition of what you mean by frontline. And I think that one of the things that may be holding us back from doing it much more widely is that 80% of the patients who do have this disease don't need to actually seek medical care. We've been telling them consistently to stay at home and not actually come into the medical system. Not so much because we don't want them to be tested, that's important, but because of the limitations of personal protective equipment, we want to make sure that it's prioritized to care in the hospital. And if we start using a lot of it to perhaps even do testing of individuals who don't need medical care, it might be diverting that resource. It's hard to think about, but all these things interplay with each other. The test supply, the PPE supply, the staff supply, they all interact, and they're all getting better, I think, each day. But they all have to improve in order for us to have the goal of this rapid testing for anyone. Did that answer the question?
Yeah, a follow-up.
Sure.
I think you would agree that we need widespread testing in order to start to relax some of these social distancing orders that are currently in place. And I wonder, if you have a sense of what the collective daily testing capacity is in San Diego County today, and how much higher it would need to go to reach that holy grail of universal testing.
I think the real capacity that needs to increase is in the commercial laboratories, and that's, again, the one piece that we don't have as much visibility on. When that gets much more prevalent and there's actually specifically more point-of-care testing that's available, like the one that's available from Abbott that is, in fact, being deployed locally in clinics and local hospitals, I think that's when we will get there. So we're not there yet. It's, again, improving, I would say, day by day.
Thank you.
Okay, we have two more questions that are on the call. Go ahead.
iNewsSource, please state your name and question.
Hi, yes, Cody Delaney with iNewsSource. We at iNewsSource contacted Supervisor Fletcher's office on Friday, and we were told that it's too hard to track the number of homeless COVID-19 patients, and that's why the county can't release that info to the public. Supervisor Fletcher essentially said the same thing at news conferences on April 1st and April 6th. But now today, the supervisor says the county does track this information and will provide it in the future. I'm wondering if somebody can clear this up. What changed from Friday to now, Monday afternoon?
I'll let Supervisor Fletcher answer that question.
Thank you, Cody. From the beginning of this, we have had a wealth of information coming in from various sources. It takes time to verify it. It takes time to ascertain its accuracy. It takes time to process. And we never want to be in a situation where we are sharing something with you that we don't have the highest degree possible confidence that information is accurate. And we have moved rapidly as a county, I suspect much more rapidly and much more transparently than other jurisdictions have at providing the total positives and then breaking those down by jurisdiction, and then breaking those down by zip code, and then breaking those down by age, and then breaking them down by gender, and then breaking them down by race. We have provided as much information as we can in real time, but it is a challenge given the variety of inputs that come in, making sure things aren't being double counted, making sure that things aren't being multiple times reported. And so we're doing everything we can to give you as much information as possible in as real time as we can, balancing the needs for privacy when appropriate and balancing the needs to make sure that our public health experts are focused on protecting the public, and that is what is taking the majority of their opinion. And so every day we look for what is something new that we feel confident that we can share, what is something we think is appropriate to share. We didn't provide breakdown by race for a while until we were able to do that, and now we do. And so we have figured out a process by which we think we are as accurate as possible in conveying the number of positive tests that are unsheltered, and we're now in a position to share that, and we look forward to sharing that in an ongoing basis. So what's changed is simply the amount of time that we take in order to make sure that we have a highest degree of confidence as possible that the data that we give you is accurate. And I want to commend everyone here at the county who has worked so hard to make so much data available in so many different formats in as accurate a setting as possible.
Yeah, thank you for that. Just a quick follow-up question. About the number of COVID-19 cases by city, can you tell me how that data is collected? For example, if someone who is staying at a homeless shelter, if they test positive, are they recorded as residing in the city of that shelter?
Yeah, this is Dr. McDonald. I really wanted to follow on to that really important point about making sure that we provide as accurate information to you as possible. I think that what needs to be understood is that information has a cost associated with it. So when you try to extract a specific data point, there are people that are actually doing some of this stuff manually by looking at records. Sometimes they're having to rewrite code to be able to extract it from databases. So it takes these things take time. And I know that you've seen on our reports, sometimes we have gender unknown, we have age unknown. You sometimes see a delay in the time it takes for deaths to be reported. Sometimes they're reported 6-7 days after the death has occurred. It's because there are a lot of processes that are involved with verification and really making sure that the data that we produce is accurate. So really I think it's an important follow-on to what the supervisor had to say. And it leads right into your question about zip codes. I think we've said repeatedly that the zip code information is something that was asked for and we provided it. It provides some idea of the distribution of where individuals are in the county and where they reside, but it doesn't mean that's where they were infected. It doesn't mean that where they may have exposed others. And so it's a data point that you have to take with a little bit of interpretation. And so you've exactly put your finger on it. Some homeless individuals are actually coded by perhaps the location that referred them for care, so it might be a shelter. Some hospitals use the hospital address as where they default code a individual who doesn't otherwise provide an address. And we know that in epidemiology, and we are able to look at that, and we're often using those zip codes as the first piece of information that we put in. But as time goes by, and as we have time to go back and do better verification of smaller data points like that, like the precise location where somebody lives, that will change over time. So you'll see, we put on every chart that we produce that this data is preliminary and subject to new information coming in. And again, I think where somebody reports their residence often can be one of those data points, because they may be reporting where they happen to be living right now this second, but it may not be their actual legal residence, and that's actually how we do our counting across the country for where cases should be counted. So I think you've probably seen multiple examples over the last number of weeks where we've had individuals who lived in San Diego but were taken care of or died elsewhere, and vice versa. So we have to sort all those things out, and that does get better with time in the data that we provide.
Great, thank you.
Okay, let's go to our last call-in question, and then we'll go to the text questions.
Caller, please state your name, outlet, and question.
With everything that's going on in all communities. So we would like maybe to send you and copy
No worries. Move to the next.
Okay. We'll go to our text questions now, and we'll go ahead and ask for the first one to be read.
This first question is for Supervisor Fletcher. It is from Steve Price at News 8. He writes, as a member of the Regional Task Force on the Homeless, what are your thoughts on San Diego police going out in the rain, shooing the homeless off public property, and issuing citations for quality of life offenses? Also, I spoke with multiple homeless people in Kearney Mesa who say they have had no contact with any outreach program. The convention center is mostly for people who were already in shelters. What's available for people who are still on the street, and how are they getting that information about options?
Yeah, I think it's, we're daily reminded that we had a homeless crisis before we had a global pandemic related to public health. The challenges of providing appropriate services and housing opportunities for the homeless is not something certainly that is new in light of what we are going through on a public health standpoint. It is something that is of increased complexity and increased difficulty to address in light of what we are presently facing. And I think a lot of times law enforcement has to bear the burden of a housing crisis, of a homeless crisis, of poverty and income inequality, of an often disjointed mental health care system, of a drug treatment system that is not where many of us believe that it should be. And they have to bear the burden of confronting that because of a series of societal challenges that they didn't create, but they are tasked with doing. And they have to do that in an environment where we are expecting law enforcement to enforce the public health orders. We're asking them to ensure physical distancing. We're asking them to ensure compliance with all of the orders to ensure they're doing their share to provide enforcement to the orders that we know will work and save lives. They also are doing that on top of existing all of the enforcing laws, or enforcing all of the existing laws that they have to do every single day as a matter of their course. And then on top of that, we have to try and give them a connection or outlet to resources to help these individuals when the reality is those resources and services are not where they ought to be, and they weren't where they ought to be prior to coronavirus and the pandemic outbreak. And it's a very difficult task. And it's a very challenging issue that we have. And in the wake of what has happened as a result of coronavirus, the challenges of providing help and services to the homeless has only gotten greater. The places that a lot of them would normally turn for their normal way of life, well, those places are closed. The places that a lot of them would go for help and services, a lot of those places are closed. A lot of the outreach workers and social workers and support staff are not able to go to work or not able to provide that. And so I think it's a reminder that we all have to do a better job, those of us engaged in trying to care for the homeless, and doing everything we can to get more of those services up and out and accessible, and doing a better job in partnering with law enforcement to let them know what's available and where they may guide. And I think that in the conflict of a global pandemic where you have to provide physical distancing, and the very great public health risk posed to our sheltered communities and our homeless shelters, and the need to ensure physical distancing with those, and the incredible speed at which the convention center was stood up, along with all the resources that went into ensuring public health there, the speed of public health nurses and homeless outreach teams, the speed of those in shelters, the speed of all of that, that there are a lot of individuals still on the street who were on the street prior. They're still on the street without access to services, and those services weren't available prior to this either. And the increased burden to law enforcement, I think that it is a very difficult situation and challenge, and one that we have to daily strive to try and do better on. And so we are working tirelessly to try and provide as many resources and as many services and as many options as possible in hopes that we can alleviate that part of the burden on law enforcement so that they can do all of the other things that we need to do. And so it's something we have to continue to monitor. It's something we have to continue to work on. It's something we have to continue to strive to do better.
This next question deals with the 250-bed hospital that was set up at Palomar Hospital. And Rob Sills, our director of the Medical Operations Center, is going to answer that question.
Thank you. The question comes from Claudia at Univision. Can you provide an update on the 250-bed FEMA project at Palomar Health in Escondido? Any word on when supplies will arrive?
Yes, thank you, Claudia. We continue to partnership with Palomar to make the space available, and we're at the mercy of FEMA on the coordination of their calendars. So they are logistically putting this here Thursday or Friday. The truck should be here for offloading and staging, and then we're going to be setting up over the weekend. The exact number and time that they arrive, we have yet to be informed by FEMA, but Palomar is making the necessary arrangements so that when it is received here, we can stand it up and be ready. Thank you.
This next question is dealing with COVID tests for homeless, and Dr. Eric McDonald will answer that question.
Thanks. This is from Lisa Halverstadt with Voice of San Diego. Thank you for providing information on positive cases in the homeless community. Can you say how many homeless San Diegans have been tested for COVID-19?
Well, the answer is we don't really know. We do know that testing of homeless individuals, especially when they're in congregate living arrangements, a shelter, or in pockets from the street, are our priority. So it is one of the groups that we, like seniors and hospitalized individuals and healthcare workers and first responders, that I believe that we are testing to a greater degree than the rest of the population. But the exact answer is we don't know. And the negative test results that we get really have very sparse information on them. Sometimes we do get a name and an address, and we usually get a gender, but often we don't get much more information than that. Sometimes the address can be difficult to interpret, as I gave in my previous answer. So we really just don't know the answer to that. It is something that we're attuned to, and again, we are prioritizing through our work with our public health nurses and our colleagues in the field, such as Father Joe's and Family Health Centers of San Diego, providers that do a lot of work already to provide services to the homeless. We know that they are prioritizing it, but again, the exact number we just don't know.
This next question deals with COVID clusters, and Dr. Wooten is going to respond to that question.
Thanks. This is from Bill Feather at NBC7. My question is regarding clusters. We are aware that there are 3 cases among employees at the Costco location in Rancho Del Rey, Chula Vista. Is this being considered a cluster, and is there any issue for customers?
Well, as we have explained on numerous occasions in terms of our contact or case investigation and then the contact investigation, that process has not changed. I am aware, however, that the definition for an outbreak now is 3 or more, as opposed to we were using 2 or more previously. So we could consider a cluster being less than the 3 outbreak number. But as we have stated before, we do not identify any locations where investigations are occurring, but know that when we get we interview each individual and try to determine if there are any sensitive occupations. And in doing that, we gather information about their close contacts. So as we gather that information and conduct our investigation, if it's a business, it will be either recorded as a congregate setting or a community setting. So at this point in time, if this is indeed individuals at this location or any other location, our investigation process is the same. And as you may recall, and everyone else, we do not identify the locations, but the businesses themselves, when they are named, they will get a letter so that they can help us contact or provide information to the rest of their workforce. So that process continues, and it has not changed.
This next question is a 2-parter, and it deals with hospitalizations, and Dr. McDonald will respond to those questions.
Thanks. This is from Tara Minto with KPBS News. She writes, 1, as I understand it, the hospitalization figures you provide are all hospitalizations, not just current. Can you provide only the current hospitalizations? 2, we have heard a few times that the real number of positive cases is likely 10 times more than what the testing shows. Has testing expanded to the degree that you feel the current total of positive cases is any more representative of the true number of infections?
Well, on the first question, we do give cumulative hospitalization figures. That's something that our branch in epidemiology produces. Our colleagues in the emergency medical services look at the day-to-day numbers for how many individuals are in the hospital and what categories they're in. I don't have those numbers available at this time, so I would defer that to my colleagues in emergency medical services. And the second question was
We have heard a few times that the real number of positive
Oh,
cases
that's right. I'm sorry,
is
yeah.
likely 10 times more than what the testing shows. Has testing expanded to the degree that you feel the current total of positive cases is any more representative of the true number of infections?
I think the answer is no, and it goes back to previous questions that I answered, that the amount of testing is not where we would like it to be able to test all who have COVID. Again, we made that estimate early on. I don't know that that factor is still applicable at this time, but it is very likely that between 2 and 4 times as many cases as are being reported to us are actually occurring in the community. We don't know that number exactly. I do think that as testing has improved, that number is decreasing, but we really don't know that number with fidelity. Another question? Or?
Yeah, and this is the final question. This is from Marilee Moore with Fox 5. It has to do with antibody testing. Over the weekend, a coronavirus antibody pilot test began in LA. Is that something that we can expect to see in San Diego County? Will antibody tests become more widely used?
Well, I think that was a question that I did answer earlier. The testing for antibodies has occurred in multiple locations across Southern California. The one that I discussed earlier was one of the first that we became aware of here in San Diego. And it is likely that antibody testing will be more frequent. The important issue is, as I referred to before, is how to interpret that information with a healthcare provider, given the timing of your symptoms. I think that the utility of or value of a drive-through test for PCR is very high. I'm not sure it's as high for the antibody testing at this point of the outbreak, but antibody testing can tell you an awful lot. It can tell you how many people might have been exposed amongst a group to give you information about asymptomatic infection. Antibody testing is also very useful to identify people who might be plasma donors at a later time and, in fact, contribute to potential therapy for those who are very ill. So there is a role for it, but again, in the environment of the drive-through example, I think we have to be very careful and have a little bit of a buyer beware attitude.
I just wanted to go back to the question about hospitalizations. Actually, the California Department of Public Health, as of April 1st, has asked each hospital throughout the state to report certain metrics. So that information on a daily basis is available on the website, and we will get that URL for everyone and include it in our Q&A. Thank you.
That concludes the questions for today, but before we break, I wanted to take an opportunity to thank Jamie from the Small Business Administration for being with us today to offer assistance to our business community. You know, as I said at the beginning, small businesses are the backbone of this community, and we need to do whatever we can to make sure they get the support as quickly as they can to be able to remain as a viable business. For more than 30 years, the South County Economic Development Council has worked to help businesses create jobs in the South Bay. But today they are needed even more than ever because of the brutal economic impact that this virus has created for all of us in the community, and certainly for small business and mom and pop operations. So over the last few weeks, they've been providing $5,000 interest-free loans to help restaurants in Chula Vista, Imperial Beach, National City, and Coronado stay open. This has been a lifeline for many of these businesses, many of which are local institutions that have served for generations of residents in those communities. I want to thank the South County Economic Development Council, especially Cindy Gomper-Graves, their executive director, and their board of directors for launching this bold initiative. I'm very proud to have been one of the founders of the South County EDC, and I appreciate their efforts to keep South County strong and vibrant. And let me urge all San Diegans to continue to support their local restaurants through food delivery and takeout services, and shop at local businesses that are still open and considered to be essential. Before we conclude, let me give you a brief update on the campaign that we launched this past Saturday to enlist all San Diegans to flatten the curve. We asked you to send us a photo of a loved one you're pledged to protect by following a simple request. Stay in place, maintain space, cover your face. Well, we've gotten hundreds of submissions, and we want to say thank you. And we want to also say to keep it up, San Diego. To submit your photo or take the pledge, go to coronavirus-sd.com. That concludes our media briefing for today. Again, we will be back here at 2:30 tomorrow. And remember, live well, stay live well, stay well, and to stay well, stay home. Thank you. See you tomorrow.